The case of the Belgian expat who tested COVID positive is still a mystery. At a seminar on Tuesday, Professor Chen Hsiu-hsi said the man most likely caught the virus from foreign national acquaintances after arriving in Taiwan in May. But the Central Epidemic Command Center cast doubt on his claim. It believes the man contracted COVID overseas as early as March.
Patient number 469, a Belgian engineer who tested positive after months in Taiwan, has baffled doctors. Professor Chen says the case almost flew under the radar.
If he had waited one more week and tried to leave on August 5th, we wouldn't have detected the case, because he has already become a negative case when you estimate from the viral load. If he'd left a week later on August 5th, he'd already been negative and we wouldn't have caught him. He'd have been gone. We would have been none the wiser.
On Tuesday, the CECC released the latest test results of the man's contacts. Of the 411 subjects, nucleic acid tests are negative for 366 and antibody tests negative for 382. Professor Chen says there are 4 plausible scenarios that explain the infection. Scenario 1, he caught the virus overseas. 2, he caught it from an imported case. 3, local transmission, or 4, repeated infection. As the man frequently socialized with friends who are foreign nationals, he thinks those contacts were the most likely source of infection.
We think the second scenario is the most likely. We can't rule out any possibility, of course. These are our recommendations. For asymptomatic cases, is there any chance they've infected a highly vulnerable demographic? For example, in the medical system or in an elderly care home. We can see what's happening in the US. Cruise liners involve close contact with others. Migrant workers often have a lot of close contact. Workplaces where there are many foreign nationals or venues where they gather or have close contact, or high-risk industries, don't get involved unless necessary. Mask wearing and social distancing must be done properly.
The college estimates that worldwide cases will hit 20 million next week, with deaths surpassing 730,000. It urges the public to be vigilant about asymptomatic carriers and to avoid contact with foreign nationals to reduce the risk of infection. But on Tuesday, the CECC questioned the college's assumptions. It said that if the conclusions were correct, there would be more infections in the Zhanghua area where the Belgian man had been staying. So far, all contacts have tested negative, giving scientists few clues.